The Minister of State, Health and Social Welfare, Dr. Tunji Alausa, continues oversight today, and this is day 2. We are currently at the College of Medicine, Lagos State, to continue today's oversight. Join us for more reports. In a bid to assess the state of health facilities across the nation, the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, visited the College of Medicine, University of Lagos for the 61st Founders Day Lecture and the Horatio Orishedulomi Thomas Memorial Lecture with the theme Transforming Healthcare and Medical Education Through Digital Innovations.
Welcome to College of Medicine. You are welcome back home. Back home. Deputy Provost.
You are welcome to College of Medicine. I'm so honored to have you back,
Yeah,
sir.
I'm so happy.
You are welcome, sir.
I was looking so much to this.
Yes.
Very excited.
Thank you, sir.
Dr. Alvin. Prof, how are you?
I'm fine,
Dr.
sir.
How are you?
I'm fine, sir.
Yeah.
Thank you, sir. You are welcome, sir.
How are you, sir?
I'm the college secretary.
You're welcome back to your home, sir.
Yeah, nice to be back.
Are you the scientific meeting? Yes.
Yes.
So you know the name for so long?
Yes. Yes.
Very amazing. It was a year you were down and now you must have slowly and steadily. So
welcome to the 61st Founders Day of the College of Medicine, University of Lagos, which is also the 17th HOT Memorial Lecture holding today. I'm doing today's event. Myself going to be working with MC Lamu of the University of Lagos Radio. So Lamu, can you come and say hello? National anthem, please. College of Medicine anthem, please. and also the Chief Medical Director of the program this morning.
To the 17th Horatio Richard Jolome Thomas, 60 Thomas, was born on the 31st of August 19, which later became the College of Medicine of the University of the Lagos University Teaching Hospital Management Board. He left office in July 1972 and on to talk about late Professor Horatio Richard Jolome Thomas. Yes, who are here seated. I want to welcome everyone once again for those one lecture. Now we move to HOT's favorite song. Are you ready? Are we going to play it? Okay, multimedia, please, can we have that? HOT's favorite song, The Lonely Shepherd.
And towards that generation, you know what I mean? For so many years, in the starting point of the University of Lagos and the College of Medicine, in this very place. And so, the college started, built a world-class research intensive medical college to deliver teaching and facilitate learning. Once again, if you read his write-up this morning, it recounts of the history of the Provost College of Medicine.
The lecture delivered by the Chairman and Chief Medical Director of Medical Arts Center, Professor Oladapo A. Ashiru, OFR, shed light on the dynamic landscape of healthcare and medical education that goes beyond pandemic COVID-19, emphasizing the need to bridge healthcare education and technology solution development through innovation amongst others.
Both Professor Olashade Tolulope Oguntola, OON, FS, Vice Chancellor, University of Lagos, ably represented by the Deputy Vice Chancellor, Management Service, Professor Lucien O. The guest speaker, Professor Oladapo Adenrele Ashiru, OFR, MEDS, Chairman and Chief Medical Director, Medical Assistant Reproductive Technology, Math Center, Lagos. The Chief Medical Director, Lagos University Hospital, thereabout Professor W.L. Adeyemo. The Acting Registrar, Mrs. Olakunle Esther Makinde, ably represented by Mrs. Helen Ripadi. The Bossa, Mrs. Olufunlayo Adekunle, the University Librarian, Professor Yetunde A. The entire members of family of the HOT Thomas, ably represented by the highly revered and distinguished teacher of most of us here who trained here, Professor Kofi Duncan, and supported by his two elegant daughters. I welcome you. The college secretary, Dr. Uyo Moses, Director of Finance, Dr. S. Atindi, the acting medical librarian, Dr. N. D. Kachi, Director of College Engineering Service Engineer Oloyede, Dean Faculty of Basic Medical Science, Professor Owatiri, represented by our historian, Professor Ego Olawa, Dean Faculty of Clinical Science, Professor F. D. Akishola, represented by Professor Ugo Temiye, Dean Faculty of Dental Sciences, Professor Ugo Dakusta, Acting Director of Student Affairs, Dr. Ruby Bankole, all professors, Senate members, and executive board members present, all directors here present, sub-dean of faculties here present, Your Excellencies, members of the corps present, other heads of teaching and non-teaching departments and units, all deputy college secretaries present, esteemed body of medicine members of staff, and the university communities, my lord spiritual and temporal, gentlemen of the fourth estate of the realm, distinguished friends of the college, guests, stakeholders, ladies and gentlemen. Great hereby. Great. Great hereby. Great. Great Akokite. Great. Great Akokite. Great. Great Akokite. Great. I warmly welcome you all to this auspicious event of the Honorable Researcher of Thomas Memorial. The 17th in the series and the 61st Founders Day lecture of the foremost medical school in Nigeria, the College of Medicine of the University of Lagos, the University of Festus, and the nation's pride. The 16th lecture was delivered by an alumnus, the Chief Executive Officer of the Eye Foundation Hospital Group, Dr. Ebute Meta, who is present here. Kindly, Dr. Hazard. A round of applause. And it took place in this same home video on Wednesday, 16th October 2019. We are gathered here today to celebrate Professor Horatio Ricardo Obitomo, CBE, OON, MPCHB, FRCS, Honorable TSC, fondly remembered as HOT, a distinguished alumnus of Birmingham University Medical School. He was born on 31st August 1917 at Jonathan Rumba Estate, Sapele. He attended Westland Boys High School, New Methodist Boys High School, now called Methodist Boys High School, and Igobi College, and the University College Ibadan, and University of Ibadan. He was the first Nigerian to be admitted to the Royal College of Surgeons of England and was a member of the academic staff of the University of Birmingham from 1943 to 1945. Professor Thomas was the first dean of the University of Lagos Medical School from 1962 to 1967, the first chairman of Lagos University Teaching Hospital Management Board 1962 to 1966, and the pioneer provost of the College of Medicine of the University of Lagos 1968 to 1972, following which he was Vice Chancellor of the University of Ibadan 1972 to 1975, to mention a few. He was a Nigerian medical pioneer specializing in facial reconstructive and plastic surgery, a visionary man that was born before his time, a man of many parts, the best among his peers, an enigma and an icon that multitasked to provide the best environment for his ambition and passion. He mentored many generations of doctors and indeed medical practitioners. This great surgeon was so passionate about medical education that he understood that medical education was an essential component of the country's development and strived tirelessly throughout his life to make the standard of medical education in Nigeria second to none. Professor H.O. Thomas was an astute academician, educationist, and administrator for himself. He was an embodiment of hope against all odds, as expressed in his article titled One Man in Our Time, published in November 1959, which mirrored a continuity in the 1930s, the threat of tribalization, the essence of multitasking, even at that time, the essence of multitasking, and respect for learning. Quoting a portion from this article, and I quote, "A man is the product of his time and people. He has obligation to serve them by exercising his talent and utilizing his training to the full. Today, conditions in the country are such that one man may have to undertake more than one. As long as he's able to conscientiously do his best to work and reasonably handle, it's not only desirable but imperative that he fills his multiple roles." I'm looking forward to listening to this lecture titled Transforming Healthcare and Medical Education through Digital Innovation for AI-Assisted Interventions to Health by a worthy ambassador, another great alumnus, pioneer chairman of the Medlag Alumni High Table Dinner and Fundraising Committee, chairman and chief executive officer of the Medical Arts Center, Institute of Reproductive Medicine in Lagos. He was appointed a professor at the very old age of 32. I repeat that he was appointed a professor at the very old age of 32 in 1983 and has published over 140 scientific papers and abstracts in 10 international and international. Professor Oladak Adelule Ashu, OSR, FAS, MBBS, PhD, FASS, FIMC, CMC, who I am confident will deliver this topic to everybody. I have to calculate. Let me at this juncture reiterate that the College of Medicine of the University of Lagos, through its efforts of our founding fathers, have made a strong track record of its triple mandate of teaching, research, and service. It is imperative to note that in 1961, Chief Dr. Ebute Meta, the former Minister of Health, was instrumental in establishing the University of Lagos State House, with its vision that one of the visions of the college is to be a great center of learning and scholarship and a training ground for men and women dedicated to the service of their fellow men and women. I'm thrilled beyond words that the HOT Foundation was established in 2006 and that the HOT family members provide sponsorship to bona fide students of the College of Medicine of the University of Lagos who have reached 7 MD or its equivalent, that's 300 levels, who are unable to complete the degree course because of lack of funds by offering bursary support, which is renewed annually until the completion of the MBBS degree, provided that such students satisfy academic performance every single session. I pray that the Almighty God will replenish the pockets of the house. Finally, it's up to us, all of us, to hold into this legacy and continue to build, to lead, to advance and improve our community, making it remarkably different from the one our founding fathers inhabited nearly 60 years ago. I therefore charge us all to making our college a world-class teaching and research intensive medical college. I would like to congratulate the 17th Honorable Shadow Thomas Memorial Lecture Organizing Committee, led by the Deputy Provost, is it there? It's trying to run in between accreditation exercises is going on and the HOT rector. Your dedication, resilience, and commitment to the cause are commendable. I wish you all an exciting presentation and journey message back to your previous presentation. Thank you very much.
The Provost College of Medicine deserves another applause, please.
The Honorable Minister of State for Health and Social Welfare, one of our own, Tunji Alausa. He deserves a round of applause. He's one of our own. Who is not only here in his personal capacity, but is also here representing another one of our own, the special guest of honor, Madam Femi Miller, the Chief of Staff to the President of the Federal Republic of Nigeria. The guest speaker, Professor Oladapo Ashiru, the Provost College of Medicine, Professor David Muke, the Chief Medical Director, Lagos University Teaching Hospital, Professor Larry Adeyemo. Other members of the university management, here ably represented by Mrs. Senator Ibayo, who is representing the acting registrar, the management of the College of Medicine, University of Lagos,
the deans of faculties here present, the heads of departments here present, all directors here present, esteemed College of Medicine members of staff, and the university community. The distinguished H.O. Thomas Family Foundation, yes, both online and present here, and we must recognize Professor Duncan, who is seated here in our midst. Distinguished ladies and gentlemen, on behalf of the 13th Vice Chancellor of the University of Lagos, Professor Olashade Ogunsola, I welcome you all very warmly to the 17th Memorial Lecture in honor of the indefatigable and amiable pioneer provost, Foundation Dean of the College of Medicine, University of Lagos, and Chairman of the University of Lagos Teaching Hospital Management Board, the only Professor Horatio Olusegun Thomas. Today, we are also marking the Founders Day lecture. And today is the 61st Founders Lecture that we are having today. Distinguished ladies and gentlemen, it is a great honor to have great personalities from various phases of life in the college here this morning to show their support, not only for our university, but also the very strong ideals that Professor H.O.T. stood for. He was loving and generous to those around him. He lived a simple life and loved educating people. He was a seasoned and astute administrator whose contribution to the upliftment of the University of Lagos is already etched in the sands of time. This memorial lecture this morning is indeed a great way to celebrate the Nigerian medical pioneer who specialized in facial, reconstructive, and plastic surgery. Distinguished ladies and gentlemen, let me also recall that we have had eminent speakers across the country that delivered this memorial lecture since its inception in 1983. These speakers include the current President of the Federal Republic of Nigeria, His Excellency Asiwaju Bola Ahmed Tinubu, Professor T. Adeoye Lambo, Professor Felix Oshiku, Professor Deji Femi Pierce, Architect Deaconess Oluwayemisi Suswan, to mention but a few. You will agree with me that the lectures that have been delivered in the past in honor of Professor H.O. Thomas usually addresses pressing and contemporaneous national and international issues, especially on economy and health. The last lecture, which was delivered in 2019 by Dr. Kunle Hassan, who is here today in our midst, was titled Health Challenges in Nigeria, Building on the Legacies of Our Leaders. Today's lecture, which is titled Transforming Healthcare and Medical Education Through Digital Innovations, from AI-assisted interventions to edutech. This lecture this morning will be delivered by Professor Oladapo Ashiru, Chairman and Chief Medical Director of Medical ART Center in Lagos here. The Provost has given us in speech some quantum of the biodata of this great faculty member of the University of Lagos College of Medicine during these days here.
Professor Oladagbashu is a professor of anatomy and reproductive endocrinology and is the first Black Secretary General of the International Federation of Fertility Societies. He is also the president of the African Reproductive Care Society. I am very sure it will be another well-researched and educated lecture for all and some. Distinguished ladies and gentlemen, we have also carefully selected the Chief of Staff to the President of the Federal Republic of Nigeria, Honorable Femi Gbadabiamila, CFR, as a special guest for his passion for the University of Lagos, as well as the interest as a true alumnus of the University of Lagos. Distinguished ladies and gentlemen, by the time we go through the current Federal Executive Council, you can be sure that University of Lagos alumni dominate that Federal Executive Council. We are no longer a group for show, we are now a group for what? For action. Greater context. Greater context. Greatest of the greatest of the greatest. Honorable Minister, sir, distinguished ladies and gentlemen, the series of lectures in honor of our founding fathers are part of our priorities to showcase their great works, which will continue to build on. May I use this medium to emphasize the vision and mission of the current administration under Madam Vice Chancellor, which is that she looks forward to an agenda to make the University of Lagos future ready, building inquiring minds, discovering sound character, and globally impacting the workforce. It is on this note, Honorable Minister, distinguished ladies and gentlemen, that I urge you all to sit back and enjoy the lecture. Thank you for your kind attention. Thank you.
Dr. Tunji Alausa, who also doubled as the representative of the Chief of Staff to the President, Right Honorable Femi Gbadabiamila, happens to be an alumni of the College of Medicine and was specially received. During his speech, he assured his readiness to promote healthcare system, management and delivery to the people of Nigeria. He reiterated the President's determination to empower Nigerians from different classes economically.
Friends of College of Medicine of the University of Lagos, invited guests, ladies and gentlemen, good morning once again. It is with distinct honor and privilege that I stand before you today, coming back to my alma mater. I can express the joy and the happiness that I'm feeling at this time. Coming here to the old great hall of the College of Medicine, this is like deja vu to me. And I'm very thankful to Almighty God for giving me the blessings and the privilege to be back here today. I'll be doing great injustice to myself if I don't come back to specifically recognize my source, the source that brought me to life, the clinical faculty of the College of Medicine, University of Lagos. Professor Okay, thank you, thank you, thank you. Professor Osalete Ebute, thank you, thank you, thank you. It was a research biochemistry. Professor Ebute was biochemistry, what do I call it, counselor, because he was a research, he was doing his postdoc then when I was first year in medical school. Thank you for pushing us out. The Dean of Faculty of Dental Sciences, thank you so much. Professor O.O. Akinloye, Dean of Basic Medical Sciences, thank you so much. Professor Helby Akinsala, Dean of Faculty of Clinical Sciences, thank you so much. And Dr. Ngozi Blessing Okachi, thank you. I hope you've extended the time of the library beyond 10 p.m. Or is it still 10 p.m.? Oh, you need to give the medical student more time to study. So, thank you. And then, let me go back to Professor Oladapo Hashiru, eminent professor of anatomy, more specifically in biology. The building of a medical education base and foundation for me and for many hundreds of medical students that graduated from this great college was by Professor Ashiru. Very distinct professor. Give him a round of applause. Very distinct professor. As a medical student, when Professor Ashiru comes to give his lecture, will come with his slides, and those will write with the marker, and then as he was talking, as he would give his lecture, he would talk about Nebraska. When I was in Nebraska. So then, for them, beyond that, the meaning of that is that, no, indirectly, it gets into everybody's subliminal brain that, look at what this my professor has been able to accomplish. I can be there as well. I can go to Nebraska as well. Thank you, Professor Ashiru. I'm grateful for this invitation as a guest of honor on the 17th Professor Horatio Oluchajolomi Thomas Memorial Lecture, which is holding today at the Old Great Hall College of Medicine. Late Professor Thomas was born in 1917 in Sapele, Delta State, Nigeria. Was an outstanding medical icon, a reputable scholar, and a distinguished and pioneer in Nigeria's space of plastic surgery. Was educated at the Methodist Boys High School, Lagos, and the University of Birmingham, England. He was the first Nigerian to be admitted as fellow into the Royal College of Surgeons of England. We all know his rich history as the Foundation Dean, University of Medical School, Lagos University of Medical School, and the Chairman, Lagos University Teaching Management Board. As the first professor of surgery at College of Medicine, University of Lagos, and the first consultant surgeon at the Lagos University Teaching Hospital. Achievement form one of the foundations of the College of Medicine. Late Professor late Professor Horatio Oluchajolomi Thomas was the pioneer provost of the College of Medicine between the years of 1962 and 1969, and after which he was appointed as the Vice Chancellor of the University of Ibadan, passed on to the glory of in 1979. Title of this year's memorial lecture is Transforming Healthcare and Medical Education through Medical Education to Digital Innovation, from Artificial Intelligence, Assisted Interventions to EduTech. This lecture will be delivered by no other person but the person of Professor Oladapo Ashiru, a distinguished medical scholar of international repute. The title of this lecture fits and aligns perfectly into our agenda for health. Federal Ministry of Health agenda, if everyone has been following the news, we've laid a 4-point priority areas that we'll be working on in the next 4 years. And let anybody be no doubt, President Bola Ahmed Tinubu's commitment to revamping and revitalizing the healthcare sector in the country. If you follow the president during his campaign, and people that know him, people that know him very well, knows when he says something, he means it. He's a politician that doesn't just talk. When he talks, he's put a lot of thought processes behind it. And whenever he makes commitment, he follows through with that commitment. And that's the person of our president, President Bola Ahmed Tinubu. From the outset with his campaign manifesto, revitalizing and revamping our healthcare sector was a big pivotal part of what the president decided and promised to set out to do. From the roadmap to Presidential Advisory Committee, now to action plans to the priority areas of where the president is working on. Healthcare sector is a huge part of this. And that's why the president was very selective in giving myself and Professor Ali Patel the privilege to head and minister the health ministry. As part of our 4-point priority areas, this lecture today align with one of the first components, our healthcare digitalization. We will digitalize our healthcare. We will start by creating a robust platform for all our federal teaching hospitals and 32,000 primary health care scattered across the country. Once we've done that, we'll begin to now roll in the states into this digital platform. We're working so hard, so assiduously to get it going. It's going to be a difficult job, but we're committed to doing this. So at the end of the day, we'll have a unique platform where people can easily share health information in a very secured and confidential manner. And this will eventually lead to better continuity of care and eventual more seamless delivery of care to our citizens. Our citizens deserve none but the best care that anybody can wish for in the world. Now, that's part of our first point agenda. So I'm very happy for the organizers of this lecture to have selected this particular topic that aligns well and fits well into this first part, which is improving the governance in our healthcare sector. Second priority area that we will be working on the healthcare sector is to improve our patient and population health outcomes by strengthening our healthcare system. We will give all our federal teaching hospitals the resources, the support they need to improve on the quality of care. And I'll be honest, it would be amiss of me to just slide over this. Our federal teaching hospitals, what they are doing today, beyond a few other states, and I'm going to be very political here, I won't mention those states that have really done well. Our federal teaching hospitals have been the one keeping the healthcare sector in Nigeria today. So let's give them a round of applause. Let's give the chief CMD, the medical director, a round of applause. We're posed and determined to support them to continue to improve on the level of medical services they deliver to our people. And these are subsidized care. I was talking to one of the medical directors the other day, and I asked him, how much do you charge a patient for a night stay? Guess what? 100 naira. That's less than 10 cents. You don't get that kind of high quality care anywhere in the world. Please give them a round of applause, please. We have some bright spots here, and let's really embellish people that have worked hard. Because public acknowledgement, public recognition will push them to continue to work hard. So, and we are determined, myself and the party are determined to give them all the resources they need to continue to improve. And I'm sure as I'm talking about the federal teaching hospital, the same thing is applicable to Professor Adeyemo worked with the National Sovereign Insurance Agency to bring the best cancer care to youth. This is the best. People are now coming from from sub-Saharan Africa to get oncology care at youth today. And they're getting it at a fraction, at 25% cost of what they will pay in their country. So let's commend everybody for what they're doing. So that's part of strengthening our healthcare system. The third priority area is unlocking the value chain of our healthcare delivery system. Today, healthcare contributes near 4.5% to GDP. It shouldn't be in a country that's endowed and rich like Nigeria. Go to any other civilized world, any other advanced economy. America that I live, healthcare contributes about 22.3% of GDP. That translates into $3.3 trillion in annual spend. We can do the same thing in Nigeria. If we're able to move healthcare as a contributor to our GDP from the 4.5% to about 15% in the next 4 years, we would be able to employ almost 500,000 people, young men and young women, give them durable job, high-paying job, a sustainable job, and fulfilling job. And we are determined to do that. Our fourth priority area is also we need to begin to think, we need to begin to act, work, and look at healthcare beyond our physical health, more as part of social health, and as well as healthcare and national security. We all knew what happened in COVID. During COVID, pandemic is going to come again. You see, you can wish it away, but it's going to come again. So we should use this time, which I Christian honeymoon period, to prepare for the next pandemic. And we're working hard to do that. Keep our country safe, prepare us for the next pandemic. And all our 4 points agenda align perfectly with Mr. President, President Bola Ahmed Tinubu's 8 priority areas, which include food security, poverty elimination, economic growth and jobs growth and security, access to capital, and inclusivity, where the president is determined to include everyone in the governance of his country, youth, women, elderly, academicians, artisans, we all contribute to the development of this economy. Mr. President, sixth priority area, improving security in our country, rule of fairness and rule of law. Everybody deserves to be treated with fairness and with respect. And then more so, it's anti-corruption drive. The president is determined to fight corruption. So these all align what we're doing at the Federal Ministry of Health and what the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, is doing to quickly move our country forward.
The high point of the day saw Dr. Alausa receive a prestigious award by the university in recognition of his contribution to improve healthcare services to humanity.
The USB's board certified nephrologist of refuge, an alumnus of the College of Medicine, University of Lagos, where he obtained MBBS 1993. Today we present you this very special award as a mark of the excellence you have displayed in medical education, and in particular for being a distinguished alumnus of the College of Medicine of the University of Lagos. I want to quickly just call the Vice Chancellor, presented by Professor Kusha.
This Excellence Leadership Award this is an award that is presented to our distinguished alumnus, the Honorable Minister of State for Health and Social Welfare. For your time and for the great strides you have made, that your tenure will be successful and impactful. And at the end of the day, we shall all enjoy the freedoms of democracy. Starting from the College of Medicine. Congratulations.
Of the University of Lagos, University of God's Choice and Nation Pride. An award of excellence in leadership, and this will be presented by our Provost, Professor David Adewale.
Inside over.
We have the members of the staff, students of the College of Medicine. I'm very, very happy to present this. Kindly, the Honorable Mr. kindly goes to the schedule of Chief of Staff. Congratulations.
Jolomi Thomas lecture, the 17th lecture. It's a privilege for me to be back home. This is home for me. And the title of the speech by Professor Ashu, a distinguished professor, who is also my professor that I adored quite highly, was aligned well with what we're doing to revamp and revitalize the healthcare of Nigeria based on the mandate that has been given to us by President Bola Ahmed Tinubu in getting each of our citizens to get the best healthcare that anybody can have in the world. Now, more specifically about artificial intelligence in medicine, this is what we're doing. We're in the era of health digitalization. We will digitalize the healthcare delivery system in our country, and in line with artificial and safe, where patient health information will be kept safe, but this will help improve the quality of care, will help with seamless delivery of care, and also will eventually lead to reduction in the cost that we spend for health. And we'll be using more money in a more efficient way to deliver the best care to our people. Thank you so much.
The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, on a tour to assess health facilities across the country, visited the Federal Medical Center, Lagos.
The place I've heard so much about.
Thank you, sir.
Yes.
Good afternoon.
She's the country director of Farm Access
And Safe Care.
Safe care, okay.
We're the only level 4. Yeah, level 4.
Also working on practice.
We're going to be working there to make all our medical products
tertiary hospital, get to that level 4. And if you have level 5, you'll get to level 5.
Well, he's the only level. We have a level 5, but only private. Grand Talon and the Evercare. Level 5.
Dr. Said is the head of clinical services. John Howell is the director of nursing services. And then my other colleague is of corporate services. Specifically, I asked these guys to come because I want to help us thank them. Now, we have this cancer center here, which have been very helpful in fixing for the bunker and the equipment. So as soon as we started building it, we approached through the head of social services, Lions, and we sold the vision. And they graciously offered to build for us 21 bed patients' home, so that the patients that are on admission can actually have their relatives there at very minimal loss maintenance charges. Talking of so we tarred the road from our hospital, the main hospital, and even tarred it and then put street lights so that our patients can move. Like I said to you, we also bought some electric that will show you ambulances that can actually go there on the main hospital. So this is the cancer center.
And I would like to see some of these.
Yes, we'll go.
After a 4-hour tour of the facility, given the hospital's massive structure,
5 actual chemotherapy beds. These are not actual chemotherapy beds. Just they will see so we have about 5 which were they have their own laboratory here. Okay. This is the female admission. Okay. So this is female admission.
What's the common?
It's 7 bedded. Then it has its bedroom and toilet. And then it has a storage bathroom. So behind us there is where the bunker will be. I hope that in 1 year they wouldn't, because we have our papers anyway. We have our signed paper with railway. And we bought it with money. Not commercial amounts
For the graduates and for the kids.
So this is the just
This is common sense here.
Yes, sir.
If you just get into an architect, they don't know.
Yes, sir.
Yeah. Because you don't need matron in ideally but to kids.
Yeah.
You need close distribution.
Yes, sir.
So this is the reception.
This is the reception.
We have 20 children with cancer dying. And they are dying because people don't wait to take care and wait for the treatment. So that was how we go to our international office and they gave us the grant to actually do this. So that at a stipend of maybe 1,000 naira to just stay, you know, so that you won't go.
This one. How long does it take you to get the construction?
6 months.
6 months?
6 months. This October is 6 months. And we intend to finish it so that because the international president worldwide is coming to Nigeria for the first time.
Oh, okay.
So it's really a privilege to have her with us.
Okay.
You know, so I was going to discuss maybe should I commission it.
When is she coming?
11 to 14.
Oh, okay.
So, but she's coming here on the 13th. No, 3 days.
In 3 days.
She's staying for 3 days.
Okay. So she's coming this month?
No,
next month. Next month. Why don't you free? Let her commission it. This is very
Yes. Yes, that's what we're going to do. All the rooms are the same. The same concept. Yeah, they are building a
to enforce
here and here. Yes, like a cabinet.
Well, this is very
So, what we are waiting for is the cleaning of the whole place. And good to go.
Are you going to put fine? I don't see fine here.
It's going to be wall.
Okay.
It's going to be wall. I'm having a banquet for on the 12th. And it's in
12th of November. No, we have we'll bring.
Okay.
Thank you.
Sorry, sir. So this is the training center. Okay. So the CPR is there, ACL actually practice. Yes. They put it on from here, and then you see what looks like an abdomen.
So there are organs inside.
Yes. Anyway, that is what they do here. So appendicitis, cholecystectomy, yes, laparoscopic surgery. Yes. So if what to do, even deliveries, intubation, and all that. So regularly, we do training every week. We train. Okay, every week. Yes. What you are doing. Yes. This has cost us a little fortune, sir. Very easy. And yes.
Well, this is good.
This is good. So this is a training center. Yes, sir. They have free
That's the
food.
standard.
Yes, sir.
That's
Yes, sir.
standard.
So this is their own.
Keep going.
So this room.
There's one more person out there.
Yeah, so maybe just 2 minutes. We're still going for the presentation in my office. Maybe about 3
storage drives.
Yes, storage drives.
So how often do you update it on this?
On the cloud?
On the cloud.
Yeah, we update every day. We take backups to the cloud.
What time of the day?
In the evening.
Okay, so
No problem.
just do an introduction.
Thank you very much. My name is Abib from Ebute Meta Limited. So we have.
Just very because I'm still going to talk and spend a lot of time with you.
Okay, no
Just
problem.
1 minute.
Okay, it's all right. So this is what the system looks like. We profile patients, send them to clinic, and generate e-wallet for the patients. So once they log in, the record staff can send their record into the clinic, and the consultant can see the.
Bring this card. So
cards.
I think what we should
So
concentrate on now is that.
So this is what the card
Yes,
looks like.
every patient that comes into this hospital gets this. Okay, this has their financial and medical
records in it.
history. And you can take this home, and with this number, you can gain access to your medical records. Okay, so then at the same time, you can pay money wherever you are, anywhere in the world. Finland, what's his first name? Because that's the first name. Sheyi.
So we will now know if the patient don't have enough money to put the bill, the patient will come to the billing unit to pay. Or even their drugs, even their every drug that
So this is specialist clinic. Again, because we're trying to control crowd. We have about now we have about
Yes.
Gynecological clinic.
Oh, Wednesday.
Which specialty? You tell me the specialty.
That's at clinic in the morning, which is around 12 and the cardio clinic will commence especially for the children. But on Monday, it's for the adults. Then,
Neurology, cardiothoracic, neurosurgery, general surgery.
What's the volume of patients?
Oh, and maybe I'll explain, and you can see the timing. It's 6:30 a.m., 10 a.m. And then the supervisor has gone to sign. Yes, sir.
I'm going to just
So this our nephrologist. We have two of them. In fact, we used to have three. We are picking one in the group. So they are located in Tennessee. Yes, sir. So it's really two. And we are praying that Zola will not drag him.
Yes, we have an infrared machine.
So maybe you go to this.
Thank you, sir.
So, sir, so every staff who comes in the morning, nobody writes the 8 a.m. because we know that it's not life. So what? Yes, and it can be demonstrated. And every week, she will bring out all the ratings and all the complaints. We analyze it and we act on it. Maybe you can go to our EMR. It's the same company that did it. Yes, it's Global that did it for us. So, yes, sir. Your network is fine. So, it does rent. Yes, that's what says the clinic. Okay. Now, when the patients come in the morning, we have to name for that. So, that it's like a queue management. Have to do. Even if they are going for dressing.
And they help you for this.
No, this is number one. Oh, number one, yeah. So you want to pay, okay? You don't have to go and do 1,000.
I want to add more money. How do I transfer?
You want him to put the money in your wallet?
No.
So that we sure that is 1%.
Don't mind that.
And I want to pay. How do I do it? And I just go to my account. This is the account number.
Yes, this is the account number. Wema Bank. And once you do that, go back to check the get storage.
Why don't you demonstrate with the card? Is there any card there? Okay, you have treated this one. So you are trying.
The long term and expire to them is longer. We now pop up to this flat.
One of the things is needs relief. The nurses, some of them not, depending on where you are working. That is the information of the patient that you give. Calculation of this before.
Wallet automatically says, okay, so you can pass the patient and give the drug. If there's no money, patient goes and pay the money back. Yeah.
So it uses the QR code to pay.
Or the QR code.
Are you
You want it full time, you are intern. You want it okay. You also full-time pharmacy. And you full-time
Pharmacist, I'm a copper pharmacist.
Pharmacist and thunder. I'm a copper pharmacist. Pharmacist Charles, full time. Full time pharmacist. So we also have our latest 6 months. I will show you the major stuff. Just 6 months.
Why get no banknotes on
they're online. They're also doing they are doing paper, whatever. Request their own documentation. And the reason is
Madina University. Where's that?
This is microbiology. This is for blood culture, blood culture system, blood culture and sensitivity. This does sensitivity.
Is your media?
Yes.
So where do you do your sputum?
We have, if it's AFB.
And does your result, does it come with sensitivity?
This is the sensitivity machine. Okay, yes. So this does the sensitivity.
Do you have MIC? Does it come with MIC for the antibiotics?
Yes.
Now, consider the model, you come in So I'm looking at lab portal and also help me here.
Everything, sex, age, everything is there. And the time that this test was done actually.
And this is your...
The sample that we are running.
You're running, okay.
We have to mix it.
When do you have your... Okay, you're mixing it.
Yes, before we run.
Want to say something?
This is your...
The body, sorry.
Oh, well, we have a more across the all come.
They all come here. And this is where you do your course and you do the...
Yes.
Okay. Do you do cytology?
Yes, of course.
Okay. Do you do any tissue marking?
Yeah, immunohistochemistry.
Immunohistochemistry.
In the pipeline.
In the pipeline. But you don't have that capacity.
Yes.
Okay, so what do you do for people with breast cancer after you've taken the sample?
Yes.
Beyond what kind of beyond the diagnosis, what else?
Immunohistochemistry was sent to Ruth.
But do you, as part of your standards of you
Yes,
send them for?
yes.
Oh, okay. You just don't have. You don't just.
Yes, the capacity, and neither do have we built the volume. Yes.
Okay, the volume.
Yes.
So, but Luke has. Okay, but Luke has immunohistochemistry.
Yes, they have immunohistochemistry.
Okay, thank you.
Thank you.
He's already saying he wants an extra. We are admit to, and that's the toilet.
The Director General of FMC, Dr. Adetamola Dada, expressed gratitude for the minister's visit, while also appreciating the suggestions offered the management and staff. The DG used the opportunity to express the challenges of the facility, which the minister assured will be resolved earnestly.
Yeah, thank you very much. I am Adetamola Dada. I'm the Medical Director and CEO of the Federal Medical Center, Ebute Meta. Oh wow! It's been a very fantastic visit, and it's expected. He has come to actually check what our hospital looks like, and like you can see, he's been in the hospital for the past 5 hours. He's gone around every department, every unit. He has spoken to the patient. He has spoken to the staff. Okay, he has looked at the entire hospital, seen our strength. He has also been able to identify our weaknesses, and he knows the challenges that we are facing, and that would actually enable him to determine where he can actually help us, so that we can deliver on our mandate better to the Nigerian people. So it's a very beautiful thing. I'm very excited that he has come to us. I'm very excited by the suggestions he has given. I'm very happy about the solutions he's profiling, and we look forward to more support so that we're able to actually deliver more care and better care to Nigerians. Oh, one major area is the human resources. We've been able to show him, and you were with us, quite a number of completed infrastructure that we need to now staff so that more services can be delivered to Nigeria in those service areas. Okay, and that needs human resources. And I'm sure you know that there's been a lot of challenges in retaining, the health workforce in the country, and that has affected everybody, and that also affected us. And of course, that has affected our capacity to, in terms of the number of patients that we can actually handle. So that's one big area, and I'm excited by the solutions is profiling and the steps is planning to take to support and help us so that we're able to deliver better on the renewed hope agenda of Mr. President and of this government. Thank you. Yeah.
In an interview with the press, the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, applauded the Director General and his team for their service to humanity, while acknowledging the facility as a world class.
Yeah, thank you. The tour is actually taking about 4 hours. And I'm very impressed with what I've seen here. I've done some several briefings with the medical directors of several of our federal medical centers and specialist hospitals. They came, presented, and now it's time to go on site to see what they're actually doing. It's been very interesting and exciting tour of this hospital. I am very, very impressed with what I've seen. This hospital compares to whatever best hospital you can get in the world. With all the constraints that we have in the country, they're providing amazing services for our citizens. And these are subsidized care. These are patients that are coming here. They're not paying economic price for the cost of care they're getting. The government is subsidizing it, and if you're getting this kind of care in a subsidized manner, this is extremely good care. I'm extremely impressed, and I have to commend the medical director of this hospital, Dr. Dada, for his passion, for his hard work. This takes hard work, and it takes commitment. It takes a lot of energy to put an edifice, a hospital like this that function well, deliver every kind of services for her people. It deserves a lot of commendation. The issue of space, this is what you get with urbanization. When this hospital was built probably 80 years ago, this is what happens in every part of the world. As we get urbanized, space becomes a constraint. You cannot stretch space, but what we now have to do, and they're doing it here, we just go vertical. We can't do horizontal building again. You level up, vertical building, and that's what the MD, Dr. Dada, has been able to do here. You can even see the premises, it's well paved, well tiled, clean, no dust. So, and I know they still have a few old buildings. They'll demolish it. If they need to expand, they can just build more high-rises here. So that's the solution for that. And one thing they've actually done, they've been able to work with Nigeria Railway Corporation to get several hectares of land, a massive expanse of land. That would also give the hospital capacity to expand.
It's been a long day at the Federal Medical Center with the Minister of State, Health and Social Welfare, Dr. Tunji Alausa. We've come to the end of today's tour. Bye for now.